So let's talk about comparing artificial disc replacement versus fusion and why you should get one versus the other and the benefits. So a long time ago, when you had a bad knee or a bad hip, we actually did fusions of those, which to me is insane. So you walk with a straight leg and can't use your joint properly. The same thing applies in the spine. We have discs that move. We get away with fusions in the spine because we have 5 discs in the cervical spine and we have 5 discs in the lumbar spine. So if you fuse 1 or 2 discs, you can still maintain reasonably good motion, whether it's in the neck or low back. However, oftentimes people develop further disease and need more than 2 discs fused, and then you start getting restricted motion and mobility. Now, the indications for spinal fusion and spinal disc replacement, whether it's in the neck or low back, are similar. Neck pain and arm pain, back pain and leg pain, both can be treated with fusion or disc replacement. The difference is fusion limits your mobility and motion, where artificial disc replacement does not. Now, 1 or 2 level cervical artificial discs are FDA approved and are approved by most insurance companies. In the lumbar spine, 1 and 2 level artificial disc replacement are FDA approved. 1 level is easy to get through most insurances. 2 level is very difficult because the approval is more recent. 80% of the patients I see are good candidates for artificial disc replacement, but some do require a fusion or a combination of the two called a hybrid, where we might fuse 1 disc and do an artificial disc next to it.